You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey vet rehabbers, welcome to the Veterinary Rehabilitation Podcast. I'm your host, Dr. Megan Kelly, and Ané Lloyd from Onlinepethealth will also be hosting today because she is going to be interviewing Alberto Rullan. He owns the Performance Equine Veterinary Service, which is a veterinary practice specifically for sports medicine in horses. And he is going to be chatting to us about vibration plate technology. Now, this is such an interesting topic because there is not a lot of research in it, and our results are mainly anecdotal at this stage. But I think it's a topic that is going to grow, and I think we're going to be finding more and more research in it. So I'm really interested to hear what Alberto has to say about how he uses this technology in his practice. So over to Ané and Alberto.
Hi, everyone, and thank you so much to Alberto Rullan for joining us on the podcast again.
Hey, thank you so much for having me. It's such an honor being here with you, Ms. Anne.
Awesome. So we're going to talk a little bit about vibration plate therapy or whole body vibration in horses today. Alberto, you use a whole body vibration plate in your clinic, don't you?
I do. I use it quite a bit. Definitely every day of the week, most hours of the day, our vibration plate is in action.
Okay, what plate do you use and why do you use it?
Well, let's start with why I use it first. That's actually going to be an easier question to answer. I use it because even though there is a little bit of lack of evidence, it doesn't mean that it doesn't help. It just means that we haven't found yet how it helps. And I use it because in people, they see a drastic effect. Especially have a personal experience with it. One of my friends was a jockey, and when he had an accident, it was in national news and everything, and it was a miracle that he survived. His vertebra split it in two vertically, so that's a real tough deal.
Wow.
So when the lumbar, he obviously was paralyzed after one of his lumbar was fractured. He went to surgery and was recovering, but he was never comfortable. He was in chronic pain every time I would see him. He couldn't ride again. He was pretty miserable. So he got a job at the track. This guy, the only thing he knew how to do was work around horses. So he got a job at the track with this trainer who back in the days was using the vibration plate for his horses. The setup that they were having was very non-specific. He basically put some vibration plates in the floor, no science, nothing. He just put the vibration plate there. And the job of this guy was to bring every horse in the floor.
Yeah.
So this guy had to get in the vibration plate with the horses. In order for the horses to have the good therapy or at least the complete therapy, and he started moving better.
Yeah.
So he went from not being able to walk much, so he's starting to feel a little bit of less pain, then eventually started to feel less and less pain. Then this guy started bending over.
Wow.
And one day Kyle came out to me and said, "Look, I'm bending over and getting up, bending over." And he seemed a lot comfortable. So I said, there gotta be something to this. The only thing that he was doing different was that he was getting on the vibration plate with the horses. So after that, I must admit that before that I was skeptical and I really did not neither utilize the vibration plate on my patients. But after that, I started looking into it. And he continued getting better. So I was like, I need to get into this. So that's basically what got me into using it. Then after that, I started using it more on patients and seeing what it does on patients. Obviously, I started reading the literature, which it wasn't very encouraging. It's still not very encouraging. However, it doesn't mean that there's no help. It just means that we haven't found out how it helps yet.
Yeah.
Obviously, horses are quite different than people in terms of body mass, right?
Of course.
And how we stand, and the biomechanics are perhaps a little different. But after all, I think that the musculoskeletal system adapts pretty similarly.
Definitely. So that's quite an amazing story. How long in the day was he spending on the vibration plate? Was that what he was doing the whole day?
Good question. Who knows? It's at the racetrack. You go to the racetrack and you start working at 4 a.m, and then the trainer tells you, go do this, go do that. So for sure, definitely at least half an hour between half an hour and 2 hours daily, for sure, of vibration plate time.
Okay, that's great. So what conditions are you using the vibration plate for clinically?
Every horse that comes here, 99% of the horses that come here have some sort of layup. So for that reason, I put most horses that come for layups in the vibration plate to try to go for avoiding significant bone loss while the horse is doing nothing.
Okay.
At least, even though there was a thesis that came out that said that the horse does not gain bone density. I think there was some paper and a little bit of research saying that it would help preventing a whole lot of bone loss. And for sure, there's quite a bit of evidence on that in the human side.
Yeah, definitely. So you've been mentioning quite a bit, and I know we recently had a post on our Facebook page about some research that was done using a TheraPlate whole body vibration system, where they showed benefit in a very small population of horses that were on stall rest, both in bone mass and in maintaining muscle. So it does seem that there is, there is some positive effect there, but yeah, there's some criticism to the research, and I haven't been able to source the whole papers myself. I've only been able to read the abstract. What research are you aware of that directly relates to whole body vibration in horses?
So we have, there's a 2018 paper, Research in Veterinary Sciences, the journal, and by the doctor I was telling you, this is Bart Halsberg. Oh, sorry, Bart, if I really screw your last name here in terms of pronunciation. This is a super nice guy. The effect of 2-month whole body vibration and hoof growth rate in the horse.
Yes.
What Dr. Bart very eloquently was able to document that there was significant increase on hoof growth on normal horses. At least these were not laminitic horses, which we tend to use this a lot in laminitic horses, sort of extrapolating the data. But that's one research right there.
That's
at least some paper.
So that definitely would make us think that it's having a positive effect on circulation, right?
Most likely it has to. Correct. Either in circulation. Go ahead.
In humans, I think that they're using it a lot as a means of exercise for people who can't exercise for whatever reason, maybe reasons or old age. Do you use it similarly so you did say horses that were on stall rest, right? That's one of the reasons that we would use it.
That's right. Because of the trying to avoid significant bone loss, like we talk about. However, there was a really interesting paper on the title is Effects of Whole Body Vibration on the Horse, Actual Vibration, Muscle Activity, and Warm-Up Effect. That's in the Journal of Equine veterinary science. What they were trying to see is if there was some significant effect on the muscle warm-up when compared to lunging or when compared to trotting versus the control. They didn't find much in this paper. They measured the temperature of the muscles and they measured the movement. However, they only used one type of vibration plate, which was one that moved horizontally and in an oscillating type way, right? Rather than pure vertical activity.
Okay.
So this is the evidence with regards to that respect of warming up. I don't know if that was kind of the question you were getting to.
Yeah, that's good. And that sort of leads me to the next kind of question in that, and I know this is a terrible question because we definitely don't have enough research, but what do you think are the best frequencies and maybe waveforms that we should be using? You mentioned an oscillating kind of vibration versus a purely vertical vibration. Like what are the differences?
Well, we don't know. I think we don't know. However, there are some manufacturers that are telling us that it's better to go vertical. There are some manufacturers that are telling us that it's better to go horizontal and or an oscillating type of wave. We don't know. But the beauty of it is what I'm seeing is that there is some activity towards researching that. And I'm very comfortable believing that at some point we're going to find out which one is better than the others, right? Because another thing that we are seeing is that we have, as a manufacturer, tell us, for example, if we are going to a setting of 15 to 25 hertz, is that real the setting that the horse is actually feeling? Where in the body is the horse feeling that? Is the horse feeling that right at the plate itself, between the interjunction of the hoof and the plate? How about in the joints? How about in the hock? Or even stronger, how about in the epaxial muscles? What kind of effect? I mean, it's obvious when you touch a horse in the vibration plate. You know, even if you're not a physics expert, you would know that, oh, this is not vibrating at 15 hertz or 25 hertz. So it's sort of like a medication. I can compare to a medication. You prescribe a set of pills, right? And then you prescribe a dose, and there are three types of dose: the one you calculate, the one that goes to the mouth, and the one that actually goes into the stomach, plus actually another one, the one that gets absorbed.
Yeah.
So it's very similar in this case. You have the frequency, and then it's depending which one gets to the hoof versus the other joint higher from the hoof. So I guess this is a long answer for a simple question, that a good start seems like they're starting at 15 to 25 hertz, right? Seems like we need to find out which of these frequencies is actually going to be more effective than the others. We don't have the answer yet, but I'm very excited to see that some people are actually measuring it. In our case, we actually have both. We have the vibration. Yes, we have the vibration, and we have the oscillating. We have the vertical vibration, and we have the oscillating.
Great.
I don't know if you're familiar with you're probably familiar with the area where I live, but there is a lot of obviously very, very high-end horses. There's a lot of very high-end trainers, and each of them do have their theories.
Yes.
And they actually request different type of equipment. They say, okay, I want my horse to get vibration that is vertical. I want my horse that doesn't get it. So what happens is that I cannot say, hey, research proof that this one is better than the other. I just have both. So we provide both of them.
Okay, and do you tend to use one for some conditions more than the other?
No, not at the moment. We're trying to help the veterinary community, and we're trying to measure some parameters. So we're recently, by the way, this is a recent movement in our clinic. We're just recently starting to figure out how we're going to start providing data on these guys and how we're going to be able to design studies so we can help the scientific community on that subject.
Oh, please do. That is that's fantastic.
Having a commercial versus a private versus a academic institution, it's a little harder on the commercial one to provide research. Obviously, academics is a little bit easier, but we definitely have to put our heads together, and everybody is going to have to start publishing whatever we have so we can come up to some conclusions and help the horse, because after all, it's about helping the horse. And I think one of the reasons the vibration plate's still here and still being used is because the clients, the horse trainers, the owners, they see and they feel it different. Sometimes they don't know how to explain it, but they see and they feel it. So it's one of those modalities where you know it's doing something, you just haven't been able to measure what it is.
What it is. That's amazing. And definitely in the horse industry, I think that can sometimes be, as you said, one of the driving factors for the modalities that we use, because the owners and trainers will decide that something works for their horse and then they want that. I wanted to ask you, I've never seen a horse on a vibration plate. How do they react?
They calm down.
Yeah.
At the beginning, they're like, oh my gosh, what's going on? What is this vibrating plate under me? Help me, save me. The world's gonna end. And but that's for about a couple seconds.
Yeah.
Then after that, they actually start calming down. And that is one effect that was statistically significant, actually. In one of the papers, they do calm down. It has a calming effect for sure.
I think that our horses are amazing. And even if they are the ones guiding us as to what is working and not working, if they're calming down on the plate, then again, I have to say, it must have some effect that is positive. They wouldn't stay there and be calm and relaxed if it wasn't having a positive effect.
That's right. Absolutely. Most horses that I see will eventually calm down and accept to it. As a matter of fact, I have seen horses that you turn loose and they will go into the vibration plate, which is a pretty interesting phenomenon to watch. The horses with laminitis, they feel uncomfortable. Those are the ones so far that I haven't been able to see that they say, okay, let's go to the vibration plate. But you can imagine that it is a very, very painful disease. Definitely. So abscesses and laminitis will tend to start walking away a little bit from it at the beginning.
Okay. Are there any contraindications to using the vibration plate?
I haven't seen one yet that I can think at the top of my head. Let me see. We have put horses with fractures. We have put horses with laminitis. We have put horses with tendon ruptures. It doesn't mean that we're trying to heal. Please make it very clear to our audience. It doesn't mean that we're trying to heal those disease with the vibration plate. But we still put them there for the previously mentioned reason, trying to avoid significant bone loss while the horse is in the stall rest area mode of rehab. Okay. So I don't recall any contraindication. How about you? Do you know of any?
No, I don't. I haven't come across anything in my readings, but I thought it would be interesting to find out if there's something that you wouldn't put on the vibration plate. How long are they on the vibration plate and how often?
In our place, they go between 15 to 30 minutes a day.
Okay, and daily or just
daily?
Daily. Okay.
Yes.
How practical is that for clinical use? I'm thinking in terms of, are the horses on store rest at your facility, or are they staying at home and then they rent a vibration plate at home and use it on a daily basis? How would that work?
In our facilities, they are at our facilities.
Okay.
Once in a while, we get a client that brings a horse in our facility to our facilities, and for the horse to go just to the vibration plate. That doesn't happen very often. It happens, but not as often. When the outpatients go into the vibration plate, it's usually because they're getting some sort of other treatment.
Okay.
Let's say they're going to the aquapacer, and then after the aquapacer, before the aquapacer, they get into the vibration plate, that sort of thing.
Okay. And the other thing that I saw in humans is that they will sometimes combine the vibration plate with some kind of exercise. So do you do your core exercises to keep your multifidus muscle and your spinal stabilizers strong during stall rest? Do you do those exercises while the horses are on the vibration plate? Sometimes
we do. That's one of those things that we trying to have a feel to see if it works better or not. So we don't know, but we have played with that. We have played with that a lot, actually. And another thing that we're playing with is doing the other modalities while the horse is in the vibration plate. For example, doing laser while the horse is on the vibration plate, or doing the magna wave while the horse is in the vibration plate. We don't know. We know that we haven't seen no side effects at all, obviously. We don't know if there's any benefit to it yet. We'll find out. We really don't have the data, but everything starts with an idea, right?
Definitely. I love that. I love that you're trying those things. And yeah, I'd love to see what comes of it and if we can get additional benefits by combining therapies with the vibration plate. That's very interesting.
Yeah, it's very exciting that we can do that too. We have a really good setup and good luck of a caseload that we can work on that.
Well, I think good luck with developing some outlines for getting data together, and I look forward to seeing some of that come out in the future. I think even retrospective studies on different conditions, there's so much value in that, just looking at how cases have turned out and how they've been treated and all together. That's one of my favorites. So I look forward to seeing what you guys come up with in the future. And thank you so much for joining us again this week on the podcast.
Thank you very much. Such a pleasure to talk to you guys. Thank you so much.
Thank you, Alberto. Have a wonderful day.
Thank you very much. And if you guys if the audience want to learn more about what we do, we publish a lot of things in our website, which is epcrehab.com. A lot of information. We put a lot of information on epcrehab.com. Very, very easy to read, and we try to keep it updated, so people know what's out there, what's new. And the rehab community is so small that it's important that we share as much information as possible.
I completely agree with you. We'll add that link in on the podcast, and I do love you on LinkedIn and seeing your stories, the cases and things that you post there. So thank you so much for always sharing. Very valuable.
Oh, great. Did you see the last one I put of Penny with a fracture? She also got vibration plate.
Shame, man. That's great. Shame, poor mare. I did see her, but yes, thank you. Keep sharing with us, and it's
absolutely
valuable.
Thank you very much.
Bye.
Vet Rehabbers, thanks for listening to my podcast. Don't forget to click the subscribe button, and it would be great if you could leave me a review. I want to know, what are you doing on the 15th to the 17th of November? It is our Vet Rehab Summit, which is our online virtual conference for veterinary rehab professionals. Find out more information at onlinepethealth.com.